Hello people, in this video we will try to look at this topic mycetoma. Mycetoma is actually a disease caused by a fungus, okay. So mycetoma, this is a mycetoma of foot as you can see here. So it is a disease, mycetoma is a disease, it is caused by fungus, okay. So it is a mycosis. So first of all you should understand it is caused by fungus. It is a subcutaneous mycosis, that is a disease caused by fungi. It is a subcutaneous mycosis. So just below this skin, what you see, the subcutaneous tissue there, this fungus will attack. So this is a subcutaneous mycosis. Remember, mycetoma, and it will form granulomatous lesion. Okay, there will be a triad here: swelling, sinus, granules, and discharge. Discharging granules from the sinuses. What will discharge? Granules will discharge. So what is the triad of mycetoma? Swelling will be there, then there is a sinus, and from the sinus what will discharge? Granules. Granular discharge will be there. So there is a swelling, and in the swelling there will be a sinus from which granules will discharge. So this is the triad of mycetoma. Okay. Next. So what is mycetoma? Mycetoma is a subcutaneous mycosis, that is, it is a fungal disease. It is caused by what? It is caused by these two, Madurella mycetomatis and Pseudotscherichia boydii. Two things are responsible, Madurella mycetomatis and Pseudotscherichia boydii. So here they have given some photo of the fungi, okay. Madurella mycetomatis and Pseudotscherichia boydii are the two causes for mycetoma. Mycetoma is the disease, okay. So you understood this much. Shall we move on? So, it is also called as Maduramycosis or Madura foot. So many names are there. Mycetoma, subcutaneous mycosis, Maduramycosis, Madura foot. Why Madura? Because it was first described in Madurai, Tamil Nadu, India. Okay. So this is Madurai, Meenakshi temple. This is the temple which is there in Madurai. Okay. A famous temple. So just remember, Madura foot, Maduramycosis, mycetoma. These are subcutaneous mycosis. It's a fungal disease caused by Madurella mycetomatis and Pseudotscherichia boydii. Madurella mycetomatis. See these names and learn them properly. Madurella mycetomatis and Pseudotscherichia boydii. Okay. So these two names you should write in the exam. Now, what are the types of mycetoma? Again, types. Whenever something is there, then again below that so many types will be there. Now, types of mycetoma, there are three types: Eumycetoma, Actinomycetoma, and Botryoomycetoma. So, three types of mycetomas are there. Now, why are there three types of mycetoma? Eumycetoma means true mycetoma. So, it is caused actually by fungus. So, that is why it is true mycetoma. Actinomycetoma is due to bacteria. That is Actinomycetes, a special type of bacteria which look like fungus. So, Actinomycetoma due to bacteria. Then you have Botryoomycosis because of Staph aureus. This is also bacteria only. And so, bacteria, Actinomycetoma is due to bacteria. Which bacteria? Actinomycetes. Okay. So, this much you understood. The types, what are the types in mycetoma? You have understood, correct? The types of mycetoma are Eumycetoma, Actinomycetoma, and Botryoomycetoma, which is caused by Staphylococcus aureus. Now, what are the differences between Eumycetoma and Actinomycetoma? So, we have to look at the differences between Eumycetoma and Actinomycetoma. We are not looking at this Botryoomycosis, right? We are not looking at that. We are looking only at the differences between Eumycetoma and Actinomycetoma, okay? For Actinomycetoma, just try to remember this diagram, so it will be pretty clear, okay? Don't worry. So, focus here. Now, Eumycetoma is caused by what? By fungi. That much you understood. And Actinomycetoma is caused by bacteria, that is Actinomycetes. This much you have understood. Now, here what happens? The granules color you should know. Grains are black or white. Black or white in fungi. And in Actinomycetoma, it will be red. White or red. Okay. Actinomycetoma, it will be white or red. Guys, did you understand this much? Now, I know it is just it a little too much. You have to remember the color of some grains, correct? Some granules, which are discharging granules. The discharging granules color you should know. In Eumycetoma, it will be black or white. Black and white, easy, black and white. And what about in Actinomycetoma, it will be white or red. So how do we make this white or red for you? Hold on. So just see if you can focus here on this line and understand. In Eumycetoma, the granules are black or white. In Actinomycetoma, it's white or red. Okay, let's take this and put it here. So the second difference you got between Eumycetoma and Actinomycetoma is the granule color. Okay, first of all, what it is caused by, and second, the granule color. Now look at details about the granule color. If it is black granules, it is caused by Madurella mycetomatis. Okay, Madurella mycetomatis if it is black granules. If it is white granules, it is caused by Pseudotscherichia boydii. Both of these are fungi. So both can come under Eumycetoma, black or white granules. Black granules means in the fungus itself, Madurella mycetomatis. If it is white granules, it is because of Pseudotscherichia boydii. White granules is because of what? Pseudotscherichia boydii. This much you understood, right? Now let us move on to the other side. White or yellow granules. Here white or yellow granules again. Here white to yellow granules is caused because of Actinomycetoma Madura. Actinomycetoma Madura. What a name, right? Nice name. Actinomycetoma Madura. It is caused by actinomycetes. You already know that. So just Actinomycetoma Madura. Actinomycetoma Madura. Okay. So it is easy name only. It is caused by some actinomycetes. What is the name? Actinomycetoma Madura. It can also be caused by Nocardia species, etc. Streptomyces aliensis. Some names are there like this. At least remember Actinomycetoma Madura. Now pink to red. If it is going to be pink to red granules, just say red granules if you are confused. Pink to red granules because of Actinomycetoma pelletiri. Okay. Now let's move on to some more differences. Okay, are you ready? So, next thing is tumor. In an Eumycetoma, the tumor is single. In Actinomycetomas, they are multiple. You can see here. Everything is going to be more in actinomycetes. Just remember here. Multiple tumors, ill-defined margins, not at all nicely defined margins. However, in Eumycetoma, there is only single tumor, well-defined margin. Okay, is this clear? See, usually in actinomycetomas, everything will be exaggerated. It's going to be red colored, multiple tumor, ill-defined margins. The sinuses appear early. There are numerous sinuses with a raised inflammatory opening. The discharge is purulent, pus comes. There are osteolytic lesions. And obviously, what will you find in the grains? Filamentous bacteria. So, let us put this also second, because it is a very easy thing to know. So, let's know that. So guys, let's look at the differences again. Eumycetoma. Eumycetoma is caused by fungi. In the grains, you will find fungal hyphae. Actinomycetoma caused by bacteria. So in the grains, you will see filamentous bacteria. Easy. Now, as we told you, in Actinomycetoma, everything is more. Tumor, multiple tumors, ill-defined margins, sinuses, they appear early. They are numerous sinuses with raised inflammation or inflamed opening. The discharge is purulent, there is pus, there are osteolytic lesions. Osteolytic lesions means what? They are lytic, they cause lysis of the bone. Osteolytic lesions will be there in Actinomycetoma. In Eumycetoma, which is a true mycosis, in true mycosis what happens? Look at this true mycosis now. Not that it is good, but compared to actinomycetes, just the differences look a little less, okay? Tumor is single, it has well-defined margin, sinuses are appearing late, they are few in number, discharge is serous, bone are osteosclerotic, there is hardening, okay, sclerotic means hardening. So here everything is like only one tumor, in well-defined margin, it is so perfectly defined margins, the sinuses appear late in Eumycetoma, they are few in number, the discharge is serous, the bone osteosclerotic lesions. So this much did you understand? So, in which the sinuses are more and they appear earlier? In Actinomycetoma, yes. In which one the tumor is single and it is well-defined margin? In Eumycetoma, yes, which is caused by fungus. Very good. So, now we are done with the differences between the Eumycetoma and Actinomycetoma. We have looked at the differences between Eumycetoma and Actinomycetoma. Okay. So, mostly everything is red in this Actinomycetoma. Multiple tumors, sinuses appear early, they are numerous in number, raised inflamed opening. So Actinomycetoma, you can remember everything as red. Moving on. Pathogenesis of mycetoma, how does this come? Actually, it comes from the soil. So if there is a trauma to the skin, these fungi will enter the skin, right? It will enter and like example, a thorn prick. This farmer just goes and there's a thorn prick and this fungus makes entry into our body. Initially, there will be some micro abscess here. Slowly, it will progress into chronic granulomatous subcutaneous mycosis. So this is granulomatous, remember. Slowly progressive chronic granulomatous lesions will be there. It affects the skin and the subcutaneous tissue. Hence, it is called as subcutaneous mycosis. That is the pathogenesis. Pathogenesis over. So now in what are we studying today? Mycetoma Madura foot. We are done with what? We are done with the pathogenesis. Now we have to move to the clinical features. Now clinical manifestations, you already know there's a triad. Basically there's going to be a swelling. From the swelling, there's a sinus which is going to discharge. And what are the discharges going to be? The discharge is going to have some granules. If it is caused because of fungus, there will be fungal hyphae. If there is because of bacteria, there will be filamentous bacteria in it. So write all those differences. You can write here the same differences what you have learnt in the pathogenesis. The differences between Eumycetoma and Actinomycetoma, you can repeat in this place, okay? Oh, how many tumors, how many sinuses, do they appear early, do they appear late? So where does the sinus appear early? In bacterial, correct? Let's confirm. The sinuses appear early in Actinomycetoma. Yes, that's right. You can see here sinuses appear early in Actinomycetoma. Are you able to see? See here. They appear early in Actinomycetoma. Okay. So the same table you can write in the clinical features also. Okay. So triad you understood, right? Triad of Madura foot you have understood. Now, epidemiology, it is there in Africa. It is there in Rajasthan in India. Actually, more it is there in Rajasthan in India. South America also some presence is there. It was first described in Madurai, but Rajasthan it is more in India. Okay. The lab diagnosis, what will you collect? For lab diagnosis, what will you collect? Obviously, you will collect the grains, correct? The grains you will collect, and how you will collect, so specifically they have written from that leg or whatever that foot. First, you have to clean it with antiseptic. Then use sterile gauze or loop. Use a sterile gauze or loop. Press the sinus from periphery and then collect the grains. Guys, specimen collection, pay attention here. Basically, this is that guy's foot. Clean it with antiseptic. Then use a sterile gauze to press the sinus, and then whatever discharge you collect the grains. That is the specimen collection. Then you will do direct examination. What you will do is wash the grains. Now you will wash the grains in a sterile saline solution. Whatever grains we collected. Now let us say in this bottle we collected some grains. Now those grains we will wash with saline and keep between the slides. And you will observe. What will you observe in Eumycetoma? This is a Eumycetoma and this is the Actinomycetoma photo. In Eumycetoma, you should see some black granules and cement-like substance. Black granules, guys. Black granules and cement-like substance. In Actinomycetoma, you should be seeing some red granules, right? But these are hematoxyl and eosin stains. So, yes, you need to check more about this from the textbook. Now, moving on. If Eumycetoma is suspected and if Actinomycetoma is suspected, this is the lab diagnosis. You have to do some KOH mount, okay? So what you will see is hyphae you will see with chlamydiospores at margin. Okay. So this is what they are saying. What is this? KOH mount showing some micellar clump. Clump. Okay. So that is what you will see in this KOH mount. So what happens if you suspect Eumycetoma? That is because if it is because of fungus, you will do a KOH mount and you will observe the hyphae with chlamydospores. Okay. So this KOH dissolves the keratin. Okay. Then you will be adding glycerol to prevent drying. And DMSO. What is DMSO? Dimethyl sulfoxide is added to digest the tissue. So if you are suspecting Eumycetoma, then you will do KOH mount and observe the hyphae with chlamydospores. Okay. You can also do normal histological staining. Right, what is that called? Histopathological staining you will do of the granules. Of the granules you will do histopathological staining and you will see the cement-like substance, right? You will see cement-like substance, palisade arrangement of hyphae in the cement-like substance, okay? If you are suspecting actinomycetoma, then what you should do, it is bacteria, right? So you will do gram staining and you will see filamentous gram-positive bacteria. What will you see? Filamentous gram-positive bacteria. Modified acid staining, you can see nocardia. Okay? Nocardia is actually partially acid-fast. So what actually causes actinomycetoma? What is the name of the bacteria, guys? Actinomycetoma Madura, correct? Example, what is causing it? Actinomycetoma Madura. And nocardia also can cause. So nocardia, if you are suspecting, you will do modified acid-fast staining because nocardia is partially acid-fast. Remember, you will do gram staining and you will see gram-positive bacteria. It will pick up the stain. So it is gram-positive filamentous bacteria. You will see the example of the bacteria that causes, that is actinomyces, that cause actinomycetoma are Actinomycetoma Madura, nocardia, some streptococcus also, right? No, it is streptomyces, guys, streptomyces. So that is a actinomyces. Okay. So we are done with this part of lab diagnosis. Lab diagnosis is not over yet, guys. We are still moving on to the next slide. So the next slide here is lab diagnosis culture. So you have to do culture, right? So culture for fungus you will do on what? On SDA, that is Sabarod dextrose agar. You will do the culture, and what will you see? The fungus you can identify by the observation of the growth rate. You will see how fast it grows, what is the colony morphology, the production of conidia and their sugar assimilation patterns. Based on this, you will identify the fungus. Okay. So you will use what? You will use Sabarod, SABO, Sabarod's dextrose agar. And on this, how will you identify the fungus? By observation of the growth rate. You will observe the growth rate, the colony morphology, the production of conidia, and their sugar assimilation patterns. Okay, so all these you will observe. So what and all you will check? How fast they are growing, how are their colonies, what is their morphology, the production of conidia, how the conidia are produced, and the sugar assimilation patterns. So all that will tell you about the fungus identification. Do you know you can also use Levenstein-Jensen media here? So to LJ media you can use Levenstein-Jensen media to culture this bacteria. Which bacteria? Actinomycetoma Madura, nocardia, etc., right? And here, how will you identify the bacteria? By their growth rate, their colony, the morphology, urease test, the fastness and decomposition of media which contains casein, tyrosine and xanthine. So basically, acid fastness. You know, nocardia is partially acid fast. Let's write that here. No, cardia is partially acid fast. Okay. So that's it about lab diagnosis. This is for fungus and LJ media for actinomycetes. Okay. So people, the lab diagnosis of mycetoma is done. So just take a recap and see what you have seen in lab diagnosis. You collected the specimen, then you washed it and directly examined it, and then you tried to do some KOH mount, gram staining and all. Then you did some culture on SDA and LJ media. Okay, so that completes the lab diagnosis. Now let us go to the treatment of mycetoma. Here the textbook says that the surgery is the treatment and then you should give the drugs. Okay. So, but in pathogenesis, we never saw any pain or any complications of mycetoma, so not sure. But they're saying this treatment is actually surgery, and following the surgery, they're going to give the drugs. What are the drugs they're going to give? Itraconazole. Guys, look at this diagram here. Itraconazole is the treatment for mycetoma, for Madura foot, and you can also give amphotericin B. For actinomycetoma, if it is Eumycetoma, you will give fungal, antifungal, and if it is actinomycetoma, you will give antibacterial, amikacin and cotrimoxazole. This combination, right, of amikacin and cotrimoxazole, this is called as Welsh regime, okay? This is called as what? Welsh regime, okay? So, amikacin plus cotrimoxazole. What is amikacin? It is a systemic aminoglycoside, correct? So, it is a systemic aminoglycoside. It will be a narrow spectrum antimicrobial. And you have cotrimoxazole, which is sulfamethoxazole plus trimethoprim. Okay. So, this is called as Welsh regime. So, Welsh regime, where does it come? It comes in treatment of mycetoma. Okay. Madura foot. So is the mycetoma treatment clear for you? So let's take a quick recap. We have finished mycetoma. So let us take a quick recap of what we have seen so far in mycetoma. So mycetoma is the subcutaneous mycosis. Okay, it is the subcutaneous mycosis, which is a fungal disease. It causes granulomatous lesion. The triad, there is a specific triad here, swelling, which is like tumor. Then you have sinus, which is discharging. And what does it discharge? It discharges some granules. Okay. So this is the triad. Okay, it is caused by what? It can be caused, Eumycetoma especially, is caused by the fungus, Madurella, mycetomatis and Pseudotschieria boydii. Okay, so these are the two which cause the Eumycetoma. There is something else called as the Actinomycetoma, which is caused by the Actino, Madura, Nocardia, Streptomyces, etc. So it is also called as Maduramycosis. This thing is also called as Maduramycosis or Madura foot. It was first described in Madurai, Tamil Nadu. There are types, like we told you, of mycetoma. There is Eumycetoma, Actinomycetoma and Botryoomycetoma. So Eumycetoma is caused by fungus, which is the true mycetoma. That's why it's called as Eumycetoma, right? True mycetoma. That's why it is called as Eumycetoma, because it is caused due to fungus. Actinomycetoma is caused by actinomycetes and actinomyces or actinomycetes. What is the correct thing? Anything is fine. Just remember, these are bacteria which are like fungi. Okay. And then you have this Botryoomycosis, that is caused by Staph aureus. Okay. So the differences between Eumycetoma and Actinomycetoma we have seen. Eumycetoma is caused by fungus and Actinomycetoma is caused by bacteria, that is actinomycetes. So the grains here will contain what? Fungal hyphae. The grains here will contain filamentous bacteria. The grains here will be black or white. Here it will be white to yellow or pink to red. Granules here will be black granules if it is caused by Madurella mycetomatis, white granules if it is caused by Pseudotschieria boydii. Here actinomycetes, if it is white to yellow granules if it is caused because of Actinomadura, and it is going to be pink to red granules if it is caused because of Actinomadura pelleteri. Okay. The tumor in Eumycetoma is single and it is well defined. In Actinomycetoma, there are multiple tumor masses with ill-defined margins. The sinuses appear late in Eumycetoma and they are few in number, though they appear late and they are few in number. Here they appear early and they are numerous raised inflamed openings. So there's discharges and all. Discharge here is a serous discharge in Eumycetoma, but in Actinomycetoma it's a purulent discharge, that is pus. Pus discharge will be there. Then coming to the bone, here there are osteosclerotic lesions. And in Actinomycetoma, there are osteolytic lesions. Okay. So that completes the differences between Eumycetoma and Actinomycetoma. Then we will look at pathogenesis. Basically, there is a small thorn prick or something and there's trauma to the skin. These fungus will enter from the soil and initially there will be a microabscess. Slowly it will progress into a chronic granulomatous lesion. So remember here that there is no, they have not mentioned, at least in the textbook I am reading, about the pain or any issue because of it. But however, the treatment is surgery. So this affects the skin and the subcutaneous tissue. Clinical manifestations, there's a triad. So you can mention the triad, that is tumor-like swelling, tumefaction, the sinus, the discharging granules. Tell about the color and the differences between the tumors, the sinuses, everything, how they appear, everything. Epidemiology in India, it is there in Rajasthan. Otherwise in Africa, South America. Okay, it is an endemic. Lab diagnosis, you will collect the grains from this discharge. Then you will directly examine it under the microscope. You will see black granules or red granules. Here, actually, it's not direct examination. They have done H&D stain. Okay. You can do KOH mount if you suspect Eumycetoma. You can do a KOH mount. You will see the hyphae with chlamydospores at margin. What will you see? Very specifically, they have mentioned hyphae with chlamydospores at margin. So if it is having hyphae, it should be a mold type of fungi, right? If it is having hyphae, so with it will have chlamydospores at margin. Spores actually in fungus, they are reproductive structures. Okay. Then you can also stain these granules. You will see cement-like substance, palisade arrangement of hyphae. Now, if it is Actinomycetoma, you will do gram staining. You should see gram-positive filamentous bacteria. You can do, for Nocardia, you can do modified acid-fast staining because Nocardia is actually partially acid-fast. Then, SDA you can culture. Now culturing you will do SDA, that Savarrod's dextrose agar you will use for the fungus. You can mention about the growth rate, the colony, the morphology, the conidia, the sugar assimilation pattern, and you can identify the fungus. And you can use LJ media, that's Levenstein-Jensen media that you use for tuberculosis, right? That one you're using in mycetoma to detect these actinomyces like Actinomycetoma Madura, Madure and all that, Streptomyces, Nocardia, etc. So here, how will you identify the bacteria? By the colonies, again, by the growth rate, the morphology of these colonies, the urease test. You will see how acid fast it is. Then you will see whether they can decompose these urea, casein, tyrosine, xanthine, etc. Okay. So the treatment here, actually they are saying it is surgery. Then you have to start the drugs. If it is Eumycetoma, you can give itraconazole and amphotericin B. These are antifungal. And if it is Actinomycetoma, you can give Welsh regime. Welsh regime is nothing but amikacin plus cotrimoxazole. Okay. Amikacin and cotrimoxazole together will form this Welsh regime. Actually, the treatment goes on for a lot of months. This, especially if it is fungus, right, they will treat it for years. Okay. So that is what we have finished about mycetoma. Hope you like this video and do well in the exam. Bye bye.